The City of Rockmart and Redmond Regional Medical Center teamed up on Tuesday evening to provide the community with more information about the COVID-19 pandemic and vaccine. Attempts to provide a live stream of the event on the Polk Today Facebook page didn't work out due to technical difficulties, but fortunately I was able to capture some of the meeting on my phone. So before we jump into this, apologies for the video quality. First though, let me take a moment to mention a sponsor, and then we can get into the COVID-19 numbers and clips from last night's town hall. I'm Kevin the editor, and we'll be right back after this message from a Polk Today sponsor. This Polk Today video is like the town hall last night, sponsored by the City of Rockmart. Among the events the city is hoping you'll come out and take part in is the upcoming Rockmart Police Department's 5K to raise money for a K-9 officer for the department. Check out the RPD Facebook page for more information about signing up in the Running for a Pause 5K happening on Saturday, October 2nd in downtown Rockmart. Sign-up fees directly support the purchase of a K-9 and the equipment required to ensure a four-legged officer remains healthy and safe in the field. Thanks to the City of Rockmart for helping to make free local content available like this video on polktoday.com. Okay, now the depressing part. Here are the statistics around the pandemic locally to date. On Tuesday, September 21st, the Georgia Department of Public Health reported that Polk County's number of COVID-19 PCR positive test results surpassed the 6,000 mark since tracking began in March 2020. The official number is now at 6,005 cases, an uptick of a new 39 people who tested positive for the virus from Monday's increase. Numbers will be updated again at 3 p.m. on September 22nd. DPH statistics also saw another 5 deaths added to the tally locally, bringing the death toll up to 113 since the first was reported in May 2020. 23 deaths have been reported in Polk County since the beginning of the month, marking the deadliest month of the pandemic yet. 5 more people were also hospitalized in the latest update from the DPH and brought that tally up to 478 people, and more antigen cases have been popping up as well. That number now stands at 2,036. The number of vaccinations has been on the increase. The state DPH reported that 14,083 residents of Polk County have been fully vaccinated to date, or 34% of the population, well below what is needed for community-wide herd immunity. 40% of Polk County residents now have had at least a single dose of the vaccine, or 16,685 people. Simply put, as Dr. Tessa Gibson of Redmond Regional Medical Center did on Tuesday night, Polk County is among the hot spots for the virus in Northwest Georgia. And as the medical professionals on stage made it clear on Tuesday night, the hospitals are full and resources are running out. Participants in the town hall also heard from local Redmond nurse practitioner Gina Ford and Dr. Megan White and Dr. Tyler Dubbs. The four appeared on stage in these clips from here on out, left to right. To avoid any sense of editorializing, I'm providing these clips in the order of which they were taken and without any further commentary on my part other than to say thanks again to Redmond Regional Medical Center and the City of Rockmart for partnering together to put on this town hall. We should also appreciate the efforts of Tammy Jarrell of Redmond for her work to organize last night's event. She also asked questions on behalf of those who tried to participate in the live stream on Polk Today, which I'm presenting in these clips as well. I appreciate viewers and readers' patience over the technical difficulties suffered Tuesday evening, and I hope soon to have an opportunity to try again. I'm Kevin the editor. I thank you for tuning into this Polk Today video. And now, onward to what medical professionals have to say about COVID.
Came, we were hearing about it, we were seeing a few cases in the clinic, but we didn't see the worst of the worst. And I thought, okay, well, this is going to happen other places. This is going to happen in the big cities. This is not going to hit here. This is not going to hit Booger Holler. Okay? It is. How many people have had COVID? Okay, a couple. How many people know somebody who has had COVID? That's a lot more. Here's one. Who knows somebody who has died? Okay, that is one person too many. Okay? Because we can't prevent all disease. We can't. We don't know enough. We're learning as we go. That's just the facts as we have them right now. We are learning as we go. It's kind of like being a parent for the first time. How many of you have kids? I got a bunch. And as parents, we learn as we go. Guys, it's bad. It's really bad. And it's not just our elderly anymore. It's not just our people who are immunocompromised. I'm admitting people into the hospital who are in their 20s and 30s, and I'm going, okay, what kind of health problems do you have? I don't have any. Okay, sometimes we get that and people are less than forthcoming. But what medicines do you take every day? I Tylenol every once in a while. Guys, these are healthy people. These are kids. These are people my children's ages. I got people coming into the hospital. Yeah, I smoked. I smoked for a couple of years, quit, and now they're on oxygen. They don't get the benefit of a long life. What we're seeing is this systematic inflammatory response to this virus, okay? It's not just a flu. It's not just mucus in your lungs that's going to get better and go away. It's your blood vessels are inflamed. The tissues of your lungs are inflamed. The medicines we give, that we work on giving you in the hospital when you're the sick of the sick, is to decrease your viral load and to decrease inflammation and to support your other systems as we go. I hope and pray that you never get to meet Dr. Dubs in a professional capacity. But if you do, you're in the best hands. My daughter-in-law, well, actually both my daughter-in-laws I had 2 new grandbabies this year. One of my daughter-in-laws was pregnant with my newest granddaughter when she got COVID. We had a prenatal. I hope and pray that each and every one of you are healthy and that you never have to go through what we see in the hospital. I pray. Statistics are right now that we are seeing more and more sickness. It's not just the sickness that's the problem, guys. We are running short on resources, which is something I never thought I would stand in front of you and say. When people get to me in inpatient rehab, they've been on the vent. They are young. People in their 30s having strokes, having heart attacks, having to learn how to walk again. It's not a disease process that you should take lightly. Now, we all go, well, what about? We're learning, guys. We're learning as we go. But one person dying is too many. Especially when it's somebody you love. Now, I can't show you. I wish I could take every one of you through our ICU unit and show you people who are struggling alone. Because they have to be. I wish you could see the nurses who are exhausted. I wish I could tell you all the people's stories. We don't have enough time for that. Our nursing homes are full. Our extended rehab facilities are full. When people are getting sick and they're weak, we're teaching family members how to take them home and care for them. And those are the lucky ones that get to go home.
With this community. You guys are our neighbors, you're our family members, our friends. We do not want to see any more death here. And our treatments can be, a good thing to get once you've had COVID, but we're still seeing people die despite how much effort we put into saving their lives when they get into the hospital. The best bet that anyone has is prevention. Prevention comes in the form of vaccines, which you got a wonderful presentation on, and understanding the numbers with regard to how good that they are working, how they are preventing people from ending up in the hospitals with severe death. Family members or friends who have been affected. I've been very fortunate in that my friends have all gotten the vaccine, and so, I haven't had very many people in my close circle who have been affected severely, except for one. And she is somebody who I truly, truly love. She is a lawyer, and she works in Atlanta, and she got COVID about 6 months ago. And she is no past medical history as far as health issues, except for being overweight, which I think a lot of the people in this community and in the world, or in this country really, are, including myself. And I think that she was shocked at what this course did to her. She had severe difficulty breathing. It's like the flu, or 14 days. It lasted months. My friend couldn't walk up the stairs. She couldn't carry her groceries. She had a lot of difficulty just getting from her bathroom to her bedroom. And this is a young woman. I don't want to see anyone in our community having those difficulties, but what I really don't want to see is anyone coming into the hospital who we do our best, but we can't do what we want, which is preventative medicine. By that point, if you've got COVID, you've got COVID, and the disease will run its course. One of the things that everyone is really shocked of when they have COVID and they're in the hospital is, what happens if I have to go on the ventilator, which is a breathing machine that we use to help people with time to get through this disease. And what we're seeing is that the number of people we have to put on the ventilator who are unvaccinated versus the number of people who we have to put on the ventilator who are vaccinated is a staggering difference. I think that when family members and I talk, and the patients and I talk, they're just, scared. They're scared because these are people just like you and me who, go on Google and they try and find good information, and they, get a little bit scared of something that they don't trust. And there's a lot of miscommunication out there about the safety of this vaccine. Dr. Gibson did an amazing job of trying to really give you the hard numbers for how safe this vaccine is. And so they don't get it. They don't get the vaccine, and then they get sick, and they think, well, maybe I won't get that ill. And then they're seeing us in the hospital, and it's staggering the number of people who I have come to enjoy seeing every day, and we have, pleasant conversations, and they're just like, Doc, I can't breathe. I can't breathe, and I can't do this anymore. And you've got this mask on my face that's completely uncomfortable. I just can't do it. And so we talk about what the next steps are with that.
Technology at first, even though it had been extensively researched. But as Dr. Gibson pointed out, we're 9 months later, and we have very encouraging data on the efficacy and the safety of the vaccine. And we have to remember, even though there is risk and unknown with the vaccine, that's not the only thing we're facing. The other thing we're facing is severe COVID. And I'd like to impress upon you that severe COVID is not something that you want to have. If we could tell who was going to get severe COVID, this would be easy. We could act accordingly, but we can't tell. The patients that I'm seeing in the last 6 weeks that have had COVID have been people that decided they wouldn't get the vaccine, and they would wait and see and take their chances and didn't think they would get COVID. And most of them are shocked and surprised and just can't believe that they're in the hospital, sick, lingering, and dying from COVID. If you get severe COVID, you end up in the hospital not feeling well. potentially headache. You're going to be weak, tired, short of breath, coughing, possibly having fevers, abdominal pain, nausea. The big problem will be respiratory, and we'll put you on oxygen. We'll start you with a mask, and as you continue to get worse, we'll put you on a high flow nasal cannula, and eventually we'll put you on a machine, which is a tight-fitting mask that we have to strap to your face so we can adequately breathe for you, called CPAP or BiPAP. And that's what severe COVID's like. You're stuck in a room. It's a lonely disease. You're by yourself with an air handler blowing negative pressure. You have oxygen blowing in your face. You have people coming to see you that are wearing gowns and masks. They're not touching your skin. They're talking to you, but through muffled voices. You can talk to your family if you're not deathly ill yet, but you're talking to them on a phone. And as you get sicker and sicker, you become weaker and weaker, and you lose the desire to do that. And so many people from COVID were able to keep them from getting worse and dying to a point, but eventually their body wears out and they give up. And it's not because they're a weak person or they have the weak will, it's because they're exhausted. The disease has destroyed them. And when that happens, if they didn't want to be put on a ventilator, they die. And if they want to be put on a ventilator, we do that. Being on a ventilator on COVID is not fun to go through. It's not a short process. We have to put you on medication to make you asleep, and we usually have to put you on medication to medically paralyze you so we can relax your chest muscles enough to breathe for you. Imagine waking up in 1 week after being put to sleep, artificially sedated, and being paralyzed. That's not normal. Imagine doing 2 weeks. Many people it takes 2 weeks if they survive. You don't recover from that quickly. People that survive severe COVID, that go through a week or two of this CPAP, BiPAP, or a ventilator, they're not physiologically normal. They're weak, their nervous system's damaged, and they can recover, but it takes time. And most of these people are needing to go to rehab. So what you're looking at if you get severe COVID is 6 to 8 weeks away from home. Unfortunately, not everyone does that. Many people die, and so they're stuck in a room by themselves, and we try to get family to come and say goodbye. By then, the patient's either too sick to really care, or they're unconscious, and then they die alone. And what we're saying is, what if you could prevent that? And you can. You know, there is uncertainty, and I think it's a justifiable uncertainty and concern about the vaccine. But we know so much more, and it really is safe. COVID is getting more contagious, it is getting more severe, and I really would encourage you to strongly consider getting the vaccine.
Okay. What are the qualifications for the antibody infusion?
There's such a long list, and it varies from institution to institution. But basically, if you're 65 years and older, you definitely qualify. If you have a BMI of 35 or greater, you qualify. If you have a BMI of 25 or greater and you have like hypertension, heart disease, COPD, you qualify. If you have any type of immunocompromised condition, you qualify, and that includes diabetes, if you're on chemotherapy, or have a history of transplants, or any other complicating immunocompromising condition, you qualify for the monoclonal antibody. And truthfully, all our offices, we actually have a checklist for it. So we have a big piece of paper, and if you call in and you have COVID, we'll actually look at your age, look at the last time you were in clinic and how much you weigh, and kind of see if you meet criteria for the antibody infusion, and then we can refer you to either Redmond or Floyd. And I heard we had run out of antibody infusion. That's what I heard earlier in the week. I don't know if we have it now, but yeah, it's a day-to-day thing.
Next question. My oldest son is 6 years old and immunocompromised, which is one reason why my wife and I are reluctant to give the vaccine. If we choose to give the vaccine, what are some things that we need to be aware of for his health and safety? And if we're able to get him vaccinated, are the side effects more serious for him because he's 6 years old?
Okay, so we're starting out first if the parents should get vaccinated. So the child is immunocompromised, right? Mm-hmm. And that would be a very good reason for the parents to be vaccinated. Because the parents could definitely get the infection. It could be asymptomatic or pre-symptomatic, bring it home to the child and infect the child, and the child having an immunocompromised condition could get severely people from COVID. Kids do die from COVID. It's the amount of children who die from COVID, definitely less than adults. I think in terms of the children population, neonates have the highest incidence of death. I believe it's like something like 1%, so 1 in 100 of little babies less than 28 will die. But if you have an immunocompromised condition, that child is high risk to have complicated and severe illness. So the parents definitely need to be vaccinated. If the parents get vaccinated, their chance of getting COVID has decreased. Their chance of getting any type of symptomatic infection has decreased. So it can only offer benefits to the child. Should the child get vaccinated? Again, we don't have any emergency use authorization for Pfizer yet for that age group, but definitely based on the data, based on peer review, once they get an emergency use authorization for the vaccination for the 5 to 11 years age group, that child should definitely be vaccinated. Immunocompromised patients, again, greater risk for severe disease, and those are the patients who really do need to be vaccinated. I mean, those are the people in our community who are frail and high risk to be hospitalized and end up on ventilators. So yes, the child definitely should be vaccinated.
We can't tell you you're not gonna get COVID, or that you're not gonna have a bad case of COVID if you get vaccinated. Just like you can't tell me, once I get in the car today and I go home, that I won't be in a car wreck, okay? What we're saying is, it gives you the best chance possible. It gives you another tool in your arsenal. I'm still gonna get in my car and go home, but I'm gonna turn my headlights on. I'm gonna wear my seatbelt, and I'm gonna watch for other drivers. And that's what we're saying. We can't tell you that this vaccine is going to give you, it doesn't give you a free pass, but it gives you a better chance.
I'm Kevin, the editor, and thanks for tuning into this Polk Today video. Make sure to like, subscribe, and share this video with others to help support free local news at polktoday.com.